Are you aware of how your burnout is holistically affecting you? Yeah, I wasn't. I thought that it was something, very mental inside of me, but it's actually affecting everything about you, including your intimate relationships. So today we have a guest on the show, and I honestly thought we were talking about pain and how our pain affects our holistic being and our holistic lives. And then I learned she's also a sex coach and how your pain and sex are so connected. A lot of times we have pain at the start of our burnout or in the middle, or it is a result of our burnout. And so it all is connected. Your brain, body, and nervous system affects your holistic life. So let's get into this conversation with Honey Hall. Honey Hall is a nurse practitioner, nurse coach, and the founder of Small Steps Equals Big Changes. She is a unique and vital specialty helping people with chronic pain have better sex. After experiencing her own burnout working in high volume pain clinics, Honey realized that pills and procedures weren't enough to heal the whole person. She now uses a holistic approach to help clients gently retrain their pain pathways, turning down the body's false alarm signals. Honey is dedicated to helping you move past fear so you can rediscover safety, connection, and pleasure in your body. This is a good one. Let's dive in. If you're done running on empty, surviving shift to shift, and feeling life fatigue, then you're in the right place. Hi, I'm Shan Wright, registered nurse, holistic life coach, and mom of four who found her way through burnout and anxiety to peace and purpose with faith-based practices and God's design for whole person wellness. Here, I help nurses like you recover from burnout, regulate your nervous system, reconnect with God, and discover your identity beyond the badge. Are you ready to start caring for you the way you care for everyone else? I am. Go reheat that coffee again, and let's beat burnout together. Honey, I am so excited to welcome you to the show.
Thank you.
So this is Honey Hall. She is nurse practitioner and pain coach. Do you title yourself as a pain coach?
Or sex coach now. But yes.
Or sex coach. Okay.
Sex and pain.
Yes, we will get into that for sure. I would love to get to know you a little bit more, and so are the listeners. So let's go through your nursing journey a little bit. What led you into nursing? We all kind of have our own journey when it comes to our nursing career, I feel. So I would love to know yours and why you are a sex coach today.
My nursing journey, honestly, it started as a kid. My dad went to nursing school, and I even have this cute little picture of me. I don't know if it was like kindergarten, but it was one of those little things of, I want to be such and such when I grow up. And I wrote nurse. So, I mean, it's been ever since elementary school that I wanted to do this. And so finally I got into it, started when I was 23, ended up being in nursing as far as a registered nurse in the hospital for about 11 years. I started out doing GI, and then went to ICU step down at a university hospital, which was just a unique experience dealing with, attendings, fellows, residents.
Yeah.
And just and with ICU step down, you get to see like everybody throughout the hospital. And so you got to learn a lot about a lot. Which I loved. It kept the job very interesting. And then I moved to oncology, which I did love. I was there for about 3 years before I left to start my nurse practitioner career. And throughout the hospital part of it, as far as having to deal with burnout, was more like at the end of the shift. I like to chart just a little too perfectionately. And so that meant staying over a little bit. But when I would get home, my routine was always to watch The Big Bang Theory. Mm-hmm. And that just kind of like relaxed my mind, and I was able to go to sleep. So that was pretty much my routine for just trying to get all that out of my mind. Worked very well. And then in 2017, I started my nurse practitioner journey. And it was a whole different level of burnout, because being a nurse practitioner, you can take your work home. That was thanks to COVID. In 2020, they gave us laptops so we could work from home. And
Yeah.
that just led to even worse behavior of trying to perfectly chart.
Yeah. You're like,
And
thank you, but no, thank you.
yeah, it was nice not to have it at home.
Yeah.
That whole time period, it was, you didn't know if you'd be able to go into the office, if people would be able to come in to see you. So they needed that. And that really was a turning point for extra burnout as a nurse practitioner because there was just too much easy access to being able to do your work. And so I would end up working all day and then also that night and sometimes on the weekend. And it just because you have this huge fear of being sued. And so you want to make sure everything looks right. And I just became obsessed with that. So I got to the point to where I couldn't even learn anything new, like trying to listen to like a educational podcast on the way home because my brain, it was like numb. Like I
Yeah.
couldn't think, I couldn't function. There were many days or nights when I would get home and I would take a few steps into the house, which was in our kitchen area, and I would just slide down to the ground. And
Mm.
because that was as far as I could go, because
Mm.
I just had like nothing left to give. And I have two wonderful little dogs, and they would come over and I would pet them, and it would relieve that numbness. And I could just kind of like feel like a human being again. I just felt like everything was taken out of me. I started drinking like
Mhm.
every night. It would just be one drink, but it was like, it was more on the have to instead of the, oh, it'd be nice just to,
Right.
have something now.
Right.
Uh, but after I left that job, I barely drink at all now. So
Yeah.
it was a bad coping mechanism.
Right.
Yeah. Yeah. Now I know a whole lot more about sleep. And I was like, well, that was a backwards way of doing things.
Right.
But unfortunately, that was the coping mechanism for a while I ended up being a nurse practitioner.
Hmm.
And then my values and their values no longer aligned. I saw that it was much better to treat people as a whole person and not just let's do an injection right here and we'll relieve your pain right there or surgery, those kind of things. So we parted ways. And I did not realize how much of all of that I carried until I left. Like
Mm.
it was about, I gave myself a month to just kind of rest because for some reason or another, jobs just weren't, I just wasn't getting the jobs. Either I couldn't work there because of my non compete clause or some other reason. So I was like, well, I've got enough no's. I'm just not going to do it. I'm just going to rest.
Mm.
And I did it for like a month. And I was like, that wasn't enough. That was absolutely not enough. So it ended up turning into like 4 months of just basically sitting on my couch. And I would have afternoon tea. I would
Mm.
have a lovely little afternoon tea.
Very nice.
And yeah, and cuddling with my dogs. And so it was a great experience. But I just did not realize how much, or as they say, my cup was empty. It was so empty. It was so empty.
Yeah.
But yeah.
I've heard so many stories of that where you're in burnout and we think there is, okay, well, I'll go sleep or I'll go take this day and rest and then I'll be better and I'll get to go back and do what I need to do and go back to my to-do list. And it's like, no, your body has no idea how to rest. And per person, you will have to figure out how to let your body rest and like that deep, deep soul rest. And it's going to look different for you. It sounded like it looked like 4 months of doing just what your soul loves, like relaxing, hanging out with your dogs, just being. And I'm sure you did some things, but like
Yeah.
it that might not be, if you think of rest, that might not be the first thing that comes to your mind, but that's what your body needed. Sometimes I talk about how something that we used to always do for rest, we're like, oh, I love to go for a long walk when I need like a rest break or a mental break, or I'm had a stressful week. I like to go for a long walk. And then you try that and it doesn't work. and you don't think, oh, maybe my body needs something else. I need a different kind of rest. And you actually have to explore different ways to rest. This one friend, like, she was in burnout and she loved her 20-minute power walks. And she said, that took me out for the rest of the day. I couldn't do a 20-minute power walk in my season of burnout. And so she had to learn how to sit on the couch.
Mhm.
So I think that's so good that you said that it's like you thought it was going to be a month and it was so much longer because you listened to your body and you said, you know what, this is going to be my season of rest and I'm going to figure out how to get to a point back to equilibrium. Like that's what our bodies want. And we work in this high functioning state for so long that it doesn't know how to get back there.
Yeah, I recently heard it described as like you no longer listen to your body. Like
Yeah.
there's absolutely no connection to it. And like in the hospital, I would ignore needing to pee. I would ignore
Right.
needing to eat, drink water, because God
Yeah.
forbid you have it at the nurse's station, and where you can actually drink.
Yeah.
And so you stop listening to your body altogether, and you just keep pushing through. And yeah, things like walks, that's not rest. That's not rest, even if it's like a slow walk. But it's being able to tell, like, when do I need to pee? When do I need to eat? Honestly, I still forget to eat.
Yeah.
It's something that I truly have to think about. I realize I'm fluffy, but I forget to eat. I honestly think I put myself more in starvation mode than anything else, which is just as unhealthy.
But yeah, I think
So there's that.
that is such a good point because it's really, if you think about it, the rest is really listening to what your body is saying and what the thoughts, like paying attention to the thoughts, paying attention to the feelings, to the sensations. And you're right. We are so accustomed, we're so trained to ignore those feelings and those thoughts for some of us our whole life because we were never taught how to eat when you're hungry and you know we just naturally sometimes learned how to hold our urine. We just did it because we didn't want to go at school or whatever the case. But
Mhm.
we're trained that way, and you have to learn how to untrain, and that takes so much intentional work.
Mhm.
Yeah.
I started learning about that when my last year of being at the pain clinic, I became what's called a nurse coach, basically like a life coach, but you happen to be a nurse. And so it just kind of comes at it from a different angle. And then I learned really about meditation
Mm-hmm.
and how to slow down and simply like your bodily or your body does normal functions you don't even think about. Like you don't think about how many muscles it takes to breathe in. Like your chest rises, all those muscles around your ribs are rising, your shoulders are rising, and then everything contracts. And then if you pay attention a little bit longer, you can feel your heartbeat. But you don't pay attention to your heartbeat unless it's beating like a ridiculously high amount.
Right.
Then you pay
Palpitations.
attention.
Yeah.
Yeah. But that's like you're far gone at that point. But it's just your everyday. And so just learning how to pay attention to that and
Mhm.
really get to know how your body feels on the inside.
Yeah.
And one little thing I didn't realize about meditation is that it improved my sex life, which
Oh,
is kind of part of the sex coach thing. Yeah,
yeah.
because you really get to feel how your body feels, and you can
Mm.
and it trains you to hone in on it. And meditation, it's not hard. It's not like people make it seem so much harder. It's just sitting. It's just being still, and it's just observing you. Or you
Yeah.
can make it that way. You can make meditation about whatever you want to.
Yeah.
One thing that I did when I was recuperating for my 4 months was I would sit there and I would try to see if I could feel my pinky toe.
Yeah.
Yeah. And I would make sure my pinky toe wasn't resting on anything. But to be able to really feel all the way down to your pinky toe, it takes a lot of effort. And that's
Hmm.
meditation. I mean, it's
Hmm.
just a simple, well, it's not simple, but I mean, that's all you gotta do.
Yeah. I love it too. I coach on that as well. And I think it's so powerful. I love to do scripture meditation and meditating on the word and being out in nature and meditating on just creation. Like there's just so many things, like you said, and how it connects to your body. And oh, it's so good. So good. So that helped you. You're saying the meditation helped you in your season of burnout to really get out of the burnout.
Hmm.
What
Yeah, to
else?
just start feeling again. Because
Yeah.
I just got completely numb, like
Yeah.
just numb, felt nothing, could hardly think anything till the next day. Yeah.
Okay. I know we're going to get into this, but when you just said, I learned that meditation helped with sex, I have never thought of that. So, I've had my experience of burnout and plenty of them. And I've just used the words. I've used the words of, I can't feel anything right now. They're like, well, what are you thinking about? I don't know, like everything and anything. Like my head is full. I can't focus on feeling one more thing right now. So
Mhm.
I know you want me to be into this, but I'm not. I've known that I cannot get to that place of being into the sex when I am so stressed out. But I didn't realize that I could help myself by, if I know it's on the schedule, to meditate earlier in the day or to make my routinely meditate so that I am more in touch with my feelings. Like I'm not in a burnout season right now, but those
Mhm.
seasons come up, they creep up out of nowhere sometimes. And you're like,
Yeah.
oh, like trauma hits and you're like, okay. I love that tip. That's so good.
Hmm. Yeah, it was just yeah, it was just a happy incident that it happened. I never intentionally was like, "Oh, this is going to help in the bedroom." It was never that. It was just simply to get more in touch with my body.
Yeah, yeah, for sure. I mean, I've heard people say that. I've heard people say, you have to improve your sex life, you have to be more in touch with your feelings and your body. And it's like that actually doesn't make sense to me. But to
Hmm.
say, it like you did with like meditation and focus on feeling your senses, your nerves, like that
Hmm.
makes more sense to my brain.
Hmm. Yeah, because some of the language that's used is very hard to comprehend. Yeah.
Yeah, well, I actually heard you on another interview sharing about how you help people with their pain and how it then kind of led into pain and sex and all that connection. But you were working in a pain clinic,
Hmm.
and so you were around these patients and then you realized you could help them more holistically. So lead us through that. How did that start and come to be? How do you help them with their pain?
It started when I went to a pain conference in 22, and I happened to sign up for this one course that was, she called herself a pain coach. And I had never heard of this, had no clue what it was. But her thought process on pain was that you don't let it be in the driver's seat.
Mm.
You put it in the back seat. And she wasn't a healthcare worker, but she had her own injury. She had a C2 tear, but she was still able to walk. Amazing recovery. And it just profoundly changed how I viewed pain. And she was able to change people's life by just changing their mindset over the phone. I mean, it wasn't anything fancy that you're doing. You're just
Yeah.
talking to people over the phone. And I was like, oh my gosh, if I can do that. I can do that. I can
Yeah.
help people. And she was making like lifelong changes. Whereas with pain management and pain clinics, it's very temporary. A lot of it's very temporary. Even with surgery, it lasts for maybe a couple of years or so. If you're lucky, you get about 10 years out of it. But this was like really, really, really changing people's lives for the long term. And so that's how I got started into finding out how I could do this. And being a nurse, I wanted to go to somewhere that supported coaching from a nursing perspective. So I was working on that my last year. Well, I didn't know it was going to be my last year, but my last year at the pain clinic. And then after I finished that course, it was a couple of weeks later where they were like, yeah, we're not going to renew your contract. I was like, oh, okay. So I was like, well, I'm going to get started on this little pain coach thing a lot sooner than I thought.
Yeah.
And then as I was helping people with their chronic pain, I noticed a big part of it was communication. And that communication could look like with their spouse, with their with a coworker. It could anybody that you have to have communication with that affects your life. So I started seeing this connection, and I was like, if there's communication problem around pain, there's communication problems around sex as well. When you have chronic pain, being intimate in any sort of way with your partner is very difficult because you hurt and you are not in the mood when you hurt. And so working with people with pain reprocessing therapy, which is where you essentially become friends with your pain and then you no longer fear it. And when that fear is gone, a lot of the pain goes away. And it's very similar to how that one lady said about just putting it in the back seat. Like it's there and it can come up, but it's not controlling your life anymore. So with that, we work on the chronic pain itself. And then we also work on communication with your partner on how to make sex enjoyable with your chronic pain. Because there will be, times where it might flare up, like you've had experiences in the past. And so you have a lot of fear around it flaring up again if you were to have sex. So we work on that fear around sex as well. And it starts small, like simply skin contact, hand holding. I mean, it starts very, very small and becoming just intimate with your partner and then works up to actually having sex. And for some people, sex is not your traditional penetration type sex. It could be just hand holding or going out and dancing. So, I mean, there's various levels of intimacy, but it's finding what works for you and your partner. Because as you become more intimate, then you become more safe feeling around your husband or wife, and you will let your guard down and you'll feel more comfortable because you can be around them because you're not worried if like one little touch on your hand or shoulder is going to turn into sex and you're just going to tell them, no, don't touch me at all. And you create this big barrier between them. And so then you lose that connection. And with chronic pain, there's already isolation with it because your life can end up turning into just doctor appointments and you know, go out and hang out with friends. And so if you're able to feel comfortable around your partner, not scared that any touching might go somewhere where you don't want it to go, then you also start feeling safe in your own home. And you want to be there. Because there are some people who don't even want to be in their house when their partner is there, just because it brings so much tension and will increase their pain.
Yeah.
So the whole connection with the chronic pain and the sex is to have connection with the most important person in your life, which then can help you feel safe and just chill in your home. And all these things lead up to your pain decreasing and being in the back seat. And it might go away altogether.
Yeah. Wow. Yes. Yes. I love that. That's such a that's such a good service that you're providing people to be able to connect with those they love again. Because sometimes in chronic pain, you're so fixated on the pain that well, if the pain would just go away, then I could get back to being connected with my spouse and then it seems like it's never going to go away. So then you're like, great, I'm in this relationship and we don't have a physical connection at all because we can't. Like, it's just all those negatives, that negative mindset that spirals you into a burnout mind to where it's hopeless and you're giving people that hope. And one of the things that I loved hearing you talk about before, which I thought was so hopeful, was this brain connection with our pain. And you shared one story. I actually already shared it on the podcast, but you can reshare it if you would like, about how this guy, his story actually even ended in the medical journal because it was so extreme. So you can share that. But then you also shared a story of, I think you just have some examples of clients that you've worked with where they said, I can no not longer do this thing that I love because it gives me pain. But then once you work with them and you get them to this place where they can go back to doing the things they enjoy and actually not have pain.
The one very fascinating thing is about this construction worker that was in the UK, and he had stepped down like real heavy, and he had a nail go through his boot. And he immediately was just in tons of pain. And so they took him to the hospital, and they weren't able to get him to calm down until they like completely sedated him. Like he was out. And then they finally were able to take his boot off, take the nail out, and then they realized that it didn't even touch him like at all. It just went through the toes. But it's your brain, it wants to protect you. So it sees that there's a nail in your shoe. So it wants you to immediately get that taken care of. So it's going to create a lot of pain, because with pain, you're going to do something about it.
Yeah.
And so it was just amazing how he was fine.
Yeah.
But his brain just put that connection.
I would love to have talked to him afterwards to be like, now what do you think? Like,
Yeah,
what is your
yeah,
brain telling you? I want to know.
yeah. And it's not to say that it's all made up in your head. That's absolutely not
Yeah.
what I am saying.
No.
All pain is real, and there's no denying it. He was experiencing pain. He wasn't making it up. He really thought he was injured. So another one was this guy. He does the rubber arm experiment. And so what he does is he has a barrier, and he for your arm to be on one side of the barrier, and then another fake arm is connected to your body. And how he makes that connection for your brain is he puts a sheet over it. So
Mm-hmm.
there's no separation.
Okay.
And so then he starts to put a feather on both your real hand and your fake hand until there's a connection made. And then people no longer feel things in their right hand. I mean, he uses pens, he uses flame, ice, and they feel nothing in the real hand, but they do feel it all in their rubber hand. And it's just to show how your brain can make a connection where there absolutely shouldn't be one. Amazing
Yeah.
story.
That is
And
crazy.
again, it's not to say that you make it up. They truly were feeling these sensations.
Yeah.
There's this part of your brain, the amygdala, is what puts you in the fight or flight. And that itty bitty part of your brain is what controls a lot of the fear that you have around pain.
Mm-hmm.
Is it starts this whole cascade, but it is truly your brain that is making all these decisions. In your brain, you have your emotions, it controls your movements, it has sensory that goes down and sensory that goes back up. So there's a lot that your brain has to do around pain that shows that it does play a part, but it's not to say that it's made up.
Yeah.
It's not.
But that, to go back to the whole sex connection, that actually, confirms it even more to if you could work on your brain. I'm thinking of the person who is so numb everywhere, maybe how I used to be. And you feel like I don't feel anything. So, but if you can work on your brain feeling again, even through these experiments, like then in a good way, right? Like these were negative experiences the shoe one, where it's like,
Yeah.
he had so much sensation when it didn't even touch him really. So it's like if you can work on that in the positive to get your body to feel things deeper and turn on your senses instead of them being so turned off, right? So is that what you do when you work with people as sex coach?
Yes, because with being able to manage their chronic pain, we do a lot of what we call somatic tracking. And that is where you just notice the pain, but just from a sense of like you're driving down the road and you're just noticing the trees, the cars, and everything like that. And so I'll have them, I like to call turn inward and just feel, is it throbbing? Is it shooting? Just what is it like? And when you look at it that way, instead of like, oh my God, I feel this extra pain and it's going to cause me to hurt more. I won't be able to walk the next day because this is how it's always happened. And you get used to that pattern. And so you fear even the slightest little twinge that you have in your body. But what I help people do is to not be scared of those twinges, They're just sensations in your
Yeah.
body. And so as we get used to noticing those sensations in your body, then it works into wonderfully in being able to feel
Yeah.
the wonderful sensations of sex.
Yeah. Yeah. That's so good. I'm sure you have clients that have had success and of course are so thankful for
Mhm.
for that work.
Yes. And like I said before, you start slow. You start very slow. One thing I recommend is like even setting a timer, like for 5 minutes. Like for 5 minutes, we're going to just simply touch hands
Yeah.
or something like that.
Yeah.
So there's very clear boundaries on how to move forward so that you don't feel pressured to just immediately jump into
Yeah.
having intercourse. So
Yeah.
it's a slow build up to it.
Yeah.
And the more that you feel comfortable with it, because you have such a history of sex not being comfortable and it hurting. So you have to, in the same way with just your normal pain in your body, you also have to build up evidence that it can be enjoyable. And by taking
Right.
those slow steps, then your brain's like, okay, we've got evidence that holding hands is enjoyable. Well, now we've got evidence that just having skin contact is enjoyable, and you keep building up these evidence. That's not a word. Uh,
Evidence-based practices.
yes, pretty much. You're making your
Yeah.
own evidence-based practice,
Yeah.
and and that's how you progress into actually being able to, if you want to actually have sex, if that is your goal. It might
Yeah.
not be your goal, but just being able to be more intimate with your partner.
Yeah. So I'm assuming you work with people one-on-one when it comes to this sex coaching, or do you what does your program look like?
Yeah, it's one on one because it
Hmm.
is a very sensitive
Yes.
topic. Even just pain itself is sensitive
Yeah.
topic. Because you just feel like you've been mistreated your whole time that you've had chronic pain. It's a difficult journey to have chronic
Yeah.
pain. So it is very individualized and one on one with clients. Usually we do a 6 month package. And for the first couple of months, I recommend having sessions that are pretty quick in succession, just because you need a lot of help with retraining your brain
Hmm.
and all your wonderful little nerve pathways. And then as the 6 months progress, we do like maybe 2 sessions a month because you need less support. So it just kind of depends on your flow of how things go.
Yeah. Yeah. Good. Speaking to the nurse who she's been living with chronic pain for a long time, but it's not so bad to where she can't do her job. She
Mhm.
does her job. She might even have a family that she takes care of, but this chronic pain, it's just there. She treats it with, I don't know, whatever kind of modality she uses. It might be medication, it might be some kind of therapy. So she's hearing you, but she's just thinking, well, this is just my life. Like I have this chronic pain and it's not so bad. It's not debilitating. So, you know, I can deal with it. What do you have what's the message you have for her?
You don't have to just deal with it. That's the biggest thing. My own chronic pain story was with my SI joint, and it wasn't debilitating to me. I was still able to do my normal workouts, yoga, everything, but it still caused a lot of pain whenever sitting for long periods of time. So it didn't control my pain as far, I mean, control my life as far as limiting it, but I did have to struggle through things like going to conferences. It was hard to sit through, you have to sit down for like most of the day or sitting for meals. So it wasn't necessarily debilitating to my life, but it did take over a lot more than what I realized. And when I got myself out of the pain, I didn't realize how much ibuprofen I was taking, how long I had to sit in heating pads everywhere that I went, and how much stress went into wondering how long is this dinner going to be? How long is this conference going to be? Which chair can I sit in comfortably? So you get so used to all these thoughts that
Yeah.
you don't think about them anymore
Yeah.
until you're out of pain. So while it might not be debilitating, it is causing a lot of stress in your
Yeah.
life.
And like we were saying before, like it's causing this disconnection between you and people in your life. And also, I think just like a presence, like if you can't be fully present in your body, in your mind with someone else if there's this little friend of pain always there, right?
Because during conferences, I would try and stretch my hip out. I'm not paying attention to what's being
Yeah.
said, or I might
Right.
not be paying attention to what's going on at the dinner table because it's like, oh my gosh, I've got to get up, I've got to walk around, but that would look weird, just kind of all those
Yeah.
things in my head. And it did affect my sex life as well. But again, I was also that person who thought I'll just have to live with it forever. This is just how it's going to be. And it doesn't have to be. And it's so much better to not be in pain.
So
So much better.
did you get coached through your pain first and then and you saw that it worked?
I was studying on different types of holistic ways to deal with chronic pain. And that's when I came across pain reprocessing therapy. And I deep dived into it and have also been trained in it. And
Right.
I was able to get myself out of it. And it did require some extra coaching, like when I was in training, to fully be able to distance myself from it. But yes, I use what I'm having my clients to do. I used it on myself. It's very effective.
Yes, yes. So you are a testament to the tactics that you use, and I think that's so powerful. You can really, really relate to your clients. So I like that answer because I think as caregivers, we are just so used to caring for everyone else and really not like we talked about in the beginning, like paying attention to our own thoughts, our own bodies, our own feelings, our own needs. And it's just, I'll take care of it in the future. When life gets a little less stressful, I'll finally pay attention. And I think it's stealing from your life now.
Uh-huh.
Yeah.
Yeah. I have a client who I made her take one day, half a day. It was just half a day for her to rest. And she didn't realize how much that would help her family life by just taking half a day because she couldn't see herself taking a whole day. And I was like, fine, half a day. We can deal with that. But even just carving out just those few hours to herself has helped so much in her personal life.
Yeah. Yeah. That's amazing. Okay. Well, how can people get in touch with you? Where are you on the interwebs? And if they need a coach, how do they get in touch with that?
You can email me at HHULL@ssebc.com. It stands for Small Steps Equals Big Changes. And there's Facebook, Honey Morris Hole. There's also Instagram, same thing, Honey Morris Hole. You can find me there. I do lots of videos that talk about all the different ways of managing pain and helping with sex as chronic pain interferes with it. So there's lots of information out there on the socials. And then I have a website as well. It's SSE, B as in boy, C as in Charlie.com.
Yes, I will put all those links in the show notes. Yes, go follow Honey Hall for more. Like it might be for you. It might be, we are caregivers, so it might be for someone else in your life that needs to be connected to Honey as their pain and sex coach. So thank you so much for being here and sharing your wisdom. I love this conversation.
Thank you.
I pray that blessed you, and it would bless me big if you would share the show with a friend or write a review. It will only take a few minutes, and it's the best way for people to find the show too. I would love to connect over on Instagram at @theshanwright, or you can email me hello@theshanwright.com. And until next time, may the Lord's face shine upon you and give you peace. Shalom.